Good day, everyone. How are we doing? This is Dr. Adiremi from Mom Health Parenting YouTube channel, and today I'm going to be talking about vaginal discharge. This is something every woman experiences post-pubertal life. We all have vaginal discharge at some point, at every point of our lives. So I'm going to be discussing things that cause vaginal discharge normally, and then abnormal causes of vaginal discharge. Then I'll talk about vaginal discharge in pregnancy. Vaginal discharge, as I said, is really normal. We have the female reproductive tract, our vagina, our cervix, our uterus, our tubes. All these parts have cells, have glands that produce secretions. And so vaginal discharge is like the body's way of cleaning. Vagina is self-cleaning, and vaginal discharge comes out as all the secretions, dead cells, dead glands. So it's essentially normal. There's nothing wrong. Vaginal discharge actually is an indication that the reproductive tract is properly functioning. Things that make vaginal discharge vary would include fluctuations in our hormonal level. What causes this? Ovulation, breastfeeding, pregnancy, menstruation, menopause. At this different points in a woman's life, we all have different kinds of vaginal discharge. What I mean is that when a woman is ovulating, she has a lot of discharge. This is because this is to enable sexual intercourse flow smoothly, enable the sperm flow smoothly towards an egg. This is just to encourage ovulation. In fact, when a woman is ovulating, vaginal discharge is one way we can use to track our ovulation. That's vaginal discharge prior to ovulation is really different from vaginal discharge during ovulation and after ovulation. Same way, vaginal discharge during pregnancy will differ from that during menopause. So yes, hormones play an important factor, or they are the most important factor that are involved in vaginal discharge production. I'm going to talk about abnormal causes. Some things aren't abnormal but can influence vaginal discharge. For instance, you're on certain drugs, antibiotics, steroids, birth control pills. These have a way of affecting our hormonal levels, and they could also affect vaginal discharge. This doesn't mean that vaginal discharge being produced then is abnormal. Normal vaginal discharge will have a very clean color, could be white, creamish, yellowish tinge. Vaginal discharge shouldn't be greenish, shouldn't be very yellow, shouldn't be black, shouldn't be bloody. If you're having bloody vaginal discharge or you're having bleeding and some blood tinge with your vaginal discharge, it's important for you to seek help, to seek care, and to be evaluated. Other things that we should look out for in normal vaginal discharge: you shouldn't have an offensive odor. If you have a panty liner and then you bring it to your nose, even without bringing it to your nose, it shouldn't have an offensive odor. It should just have a very plain, neutral odor. So I've talked about how it should look like, color, smell. Another thing is it shouldn't be too copious. Even when you're ovulating, you could discover that you have more vaginal discharge than normal, but vaginal discharge shouldn't be excessive. Causes of abnormal vaginal discharge majorly should be infections, sexually transmitted infections. You're having a partner with multiple sexual partners, or you're having yourself have multiple sexual partners. You're not practicing safe sex behavioral practices. All this can lead to abnormal vaginal discharge in the sense of you could have a sexually transmitted infection, gonorrhea, chlamydia, pelvic inflammatory disease, anything that could involve the reproductive tract and can cause an infection could present as abnormal vaginal discharge, where you have a discharge of a very different color from normal, offensive odor, or a discharge that is really copious. It's important for you to take note of all these factors, and if you see any difference or if you think that your vaginal discharge is not normal, please seek care. In pregnancy, vaginal discharge really varies. It's usually more stringy, stretchy, more sticky. It could have a more creamish look, yellowish look. This is absolutely normal. But if you think it's offensive in odor, if you think you're having other things that could suggest vaginitis, you're having itching, burning sensation in your vagina, you're having other things of itching, you have sores, other things accompanying this vaginal discharge, that you're having a clue or an hint that it's not normal, please seek care and see your physician. Thank you very much.